And we are live. Good evening,
Hello.
everyone. Nicole Nifo here from Perinatal Massage Therapy Education. I'm joined by my amazing friend and business partner, Michelle Francis Smith.
Hello, hello. Good evening, everyone.
I had a great weekend with you last weekend. We were at the Canadian Massage Conference. We got to meet a lot of you in person, which we love. So I hope some of you that were at the conference are joining us today.
Mm-hmm.
And for those of you who follow us every Thursday or who would like to follow us every Thursday on our Facebook Lives, don't forget to follow on the Facebook page. And that way you'll get notifications when we're about to go live, and you'll kind of be the first to know. But otherwise, just mark it in your calendar that every Thursday we are here at 8:30.
That's right. Looking forward to this always.
Yes. So yeah, let's get into it. So today we're going to be talking about some of the tools that Michelle and I think that every massage therapist needs to basically dispel any of those myths that we're hearing that are associated with pregnancy massage. What are some of the myths that you guys hear? Hey, Bhavani. What are some of the myths that you guys hear in regards to pregnancy massage? That you've come across from either patients or doctors or other therapists that you see in other groups? What are some things that you're not sure if it's a myth or not? Please comment below. And Michelle, let's give some examples of myths that we hear a lot in our practice and in our teaching.
Sure. So I think one of the most common ones is from the massage therapist perspective, them feeling that sideline massage is not effective for being able to go deep. Like if they're a deep tissue therapist or they're a specific type of therapist, well, sideline positioning, I can't really get in there, or it's not as easy to get in there. I think that's a common myth.
Yep. I definitely agree with that one. Another myth that I heard recently is that you can't do any kind of psoas release during pregnancy massage.
Mm-hmm.
Yeah. Okay. So we have one here from Holly. I can't get low back treatment if I'm in my first trimester. So that's an interesting one that we always end up talking about in our trainings and in our presentations that we do. So let's talk about, lower, like treating certain parts of the body in first trimester. So that comes up a lot too, is not just lower back. It's also like, the ankles and this point and that point. What do you want to say about that, Michelle?
Oh, good. She also mentioned that I can't get my feet treated or I'll go into early labor.
Yeah.
Those two seem to go hand in hand.
Yes.
Well, I guess the first question is, if this were the case, we would have so many people delivering, not just because of massage therapists, but because their partner has touched their low back, rubbed their feet.
Mm-hmm.
You couldn't wear a good anklet sock because you never know, you could be popping out a baby if you have those socks on too tight. Riding shoes would be a bit of an issue.
Yeah.
Like when we really break it down and think about it sort of more logically,
yes,
we know that there's a source from which the myth comes from, and we're not downplaying that. There are definitely some schools of thought around this. Traditional Chinese medicine, acupuncture, reflexology. There are some schools of thought that describe certain points, but even in their studies, they don't say, if you press this, a baby will come.
Yeah.
There's a whole treatment protocol, and if you haven't been trained in that, there's no way you can do it by mistake. And the research still isn't even there to support it. So we know it's a myth for these reasons that I've just outlined, yet still I see massage therapists perpetuating myths because they'd just rather stray away from those areas than risk. I don't even know what it is that they think they would risk. And then clients are Googling and all of that. And so then they're being filled with that information and they're also kind of tentative. So I think it's important to have some outcomes and actual measurements to actually go into these kinds of conversations with.
Exactly. And something that I found through speaking to other therapists is that some of these myths are coming about from being in school, from having instructors that maybe don't understand what it's like working with perinatal patients because it's not in their kind of scope of what they like to treat. Or maybe it's just kind of like generations of myths being passed down. It just gets so embedded into our industry. And I just think, like, you're right. We need to have some better ways of looking at your patient or their treatment rather than just giving into the fear. Because I think that's really what the underlying thing is there, right? Is fear.
That's right.
That's right. Myths. So some of the things that we wanted to talk about. So we were saying there's going to be 3 things that you must know to provide safe and effective massage to your pregnant patients. And they won't stop talking about how amazing your treatments are. Like, once you're a therapist that has hands that just are so comfortable treating their pregnant body, and knowing that you're there to support them during all their transitions from different trimesters and into postpartum, knowing that you are that source of information, knowing that you have the confidence really makes a big difference. And Michelle and I both have seen this in our practice, that patients just keep referring everybody. The mommy groups go crazy on Facebook. Your name just keeps popping up everywhere. If it were that easy to induce labor, there wouldn't be so many unnecessary medical inductions. Yeah, it's true.
We would just go to Costco and we would buy anklets. We would just get lots of socks. Honestly.
I like my socks from Costco, actually.
Me too. But I'm thinking, like, we'd have like a tagline: "Don't wear these when pregnant."
Yeah,
true.
Yeah, it's true.
Right.
So some of the things that we thought maybe. So number 1 could be common presentations of pregnancy and the impact on the changing pregnant body. So we're thinking that if you hear a myth or you hear something that you're not sure about, either a patient tells you or a colleague, this is maybe step 1 that you can take to kind of dispel this myth within yourself.
Hi,
number
Lindsay.
2, yeah. Hi, Lindsay. Number 2, tools of the trade, treatment protocols that result in safe and effective treatment outcomes. And number 3, positioning and draping and body mechanics to get the job done right and have repeat business and endless referrals.
So just to pick up on
go ahead.
As Nicole said, if you start with the number 1 and you actually have that sense of what are common presentations and you're comfortable with these presentations, it's a lot easier to figure out, well, what tools would I use to support and be effective with my treatments? And then it takes the fear out. I think when you're not comfortable with the presentations, then you're sort of tentative because you're afraid. You're afraid you're going to make something worse. But remember, guys, that pregnancy is a state of wellness. It's not a pathology. It's not an illness. It's not a diagnosis. And then when you have the tools, then the positioning, the draping, and the body mechanics can just flow from there, because then you have a sense of, this is my intention. I want to work in this area. Let's say it's QL, the low back. And then once you have that intention, your draping should match, and then your body mechanics should match. I think what happens is, over the years of teaching this stuff, is that people just don't have enough exposure or practice using this position and the draping together with an actual pregnant patient. And so when you don't have that practice, you still feel like, I've done some sideline, but I wasn't on a pregnant client, so I don't really know how I would loop the sheet or how I would secure the sheet here. That's, I think, what's often lacking, is that people don't have a lot of experience, and then they kind of shy away from it. Instead of just trying it more. Like, clients are so forgiving.
I know.
They just want you to do your best work. They want you to be comfortable so that you can be effective. And we try to create that opportunity when we offer training, when we have our clinic. It's for that exact reason.
And for those of you who don't know, Michelle is the drape queen. Her draping is famous.
I love to drape.
She can drape with like the weirdest shaped sheet and figure out a way to twist and turn it so that it doesn't expose the patient's body, and that it's nice and secure. And Michelle's draping is awesome. It's definitely perfected my draping, which, after 10 years of practice did kind of get a little lax. I can definitely say in my practice now, it's a lot better, because from working with you, Michelle. But definitely draping and positioning and ergonomics are really important to us. This is something we talk about in our training. And we really want to make sure that the therapists are comfortable because, like I said before, if you have that confidence in your hands and you have that confidence in what your abilities are in your treatment, your patient feels that. So many times I've had patients tell me like, oh yeah, the therapist put this like weird shaped plastic thing between my legs and it felt really uncomfortable. And then also when the therapist was treating me on my side, I kept feeling like I was being rocked and I was going to maybe get pushed off the table. And there's so many things when I hear those comments from patients where I'm like, they needed more pillow weight support. They needed to drape you better. They needed to, have more confidence so they could access your body in such a different way. And I'm sorry, I don't treat prone in second and third trimester. I can't reach all of the areas of the patient's body that need treatment during those trimesters that really are feeling strained or tight or shortened. I can't access them when they're laying down in prone. I can access them better when they're in sideline. And I've worked it so that my body, doesn't feel any different treating in sideline than it does prone or supine. Right? The more you practice these things, the better you get. And so if you just automatically go to what you think is easy, which is maybe using a prone pillow or a table with a hole in it, who is it easy really for? Because as a therapist that practices sidelining in pregnancy, it's actually easier to have them on their side because it's less I have to move them.
That's right.
Right?
And then you can do that whole 3D access as you've talked about before.
Love the 3D.
Which is so effective.
Yeah.
You can use your stool. I mean, I use my stool quite a bit in sideline. I can get some great access points.
Yeah.
And one other benefit of sideline in that second and third trimester is often I'm teaching my clients again and again how to actually position themselves for rest and for sleep.
Yeah.
It's amazing how many people are pregnant and their pillow is like under their shoulder. And they're wondering why their neck is killing them. And it isn't until they're on the table. And I'm like, could you lift your head up? Let me just do this. And they're like, oh, I can sleep like this. And it's like, yes, you could sleep with that wedge under your belly and a couple of pillows between your knees. You could totally do that. So there's so many benefits. So positioning your patient during the massage, teaching them some ergonomics for resting when they're at home. Sometimes pregnancy is very foreign to some people. They, maybe have never really been around a lot of pregnant people. It's maybe their first pregnancy. Maybe it was unexpected. And so you have to imagine that like them coming to you and wanting this sort of nurturing to their body during this time can be very foreign to them. And so they're sometimes looking at you as the massage therapist for that support on, how they should be sitting or standing and, what exercises will really help make them feel good and what's the best position when laying down. And many patients have asked, like not just pregnant, but patients in general, what's the best pillow to sleep with at nighttime? And I'm like, I don't know. I don't even know that answer. What's the best bed? Yeah, people ask me what's the best bed based on my back issues.
So they're really looking to you for information because they're like, you're the expert, right? And you are. And so when you're having a patient come in and they're maybe dictating to you on what position you should be treating them in, I don't really think that that's doing the treatment or the patient or your body any justice, because you could be giving that much of a better treatment in a position that you're not straining your body and for sure there's no strain on their body.
Absolutely.
Right? So I definitely think, when you're hearing these different myths or when you're having, these different things come up in practice, like we said earlier, you have to look at, what are the presentations that are being shown and really like, what are you afraid of? Are you afraid that you're going to cause early labor? Are you afraid you're going to be, pressing into the baby if you're treating in the QL or the PSOAS? Are you afraid of hurting the patient, right? So you have to look at where the fear is coming from. Communication is key, right?
Right.
Keeping that.
And I think if you're able to identify that the fear is coming from a clinical consideration, that's a different trail,
Yes.
Because then you have to go through your checklist of, okay, you know, what is this about? Is this affecting circulatory system? Like what system is
Exactly.
this affecting?
Yeah.
But when it's just fear for fear's sake, or fear because someone told you this particular piece of information, you've never read it in a textbook,
Yeah.
you've never actually met a patient or client with this presentation, you've never actually heard of anyone in practice. It's just one of those do not ever, ever, never touch the low back.
Yeah.
Or I think it's in I don't know if I should say the province. I think someone was saying something to me about in Alberta, some of the therapists. Yeah, it was. We were having a conversation at the conference.
Yeah.
That there are many therapists who just will not treat in the first trimester.
Yeah.
If you're in the first trimester, you will not receive a massage. They've CI'd the first trimester. This is what we heard from someone. I don't know if this is 100% true. Somebody out in Alberta can shed some light on that, if that's something that's being taught in the schools, or if there's a liability or something that we're not aware of.
Well, some organizations as well we've seen in the States, they have like in their manuals for the company, they had that they weren't doing massage in the first trimester, and then the person that was redoing the manual said to us, like, do you have any proof of this? We're like, no. There's no research or study or proof that this is actually, in fact, a CI for massage therapists.
That's
so, you know, obviously, you know, if someone's going through fertility clinics and going through IVF, they may recommend to the patient to basically not do anything. Like, don't even walk. Like, just lay in your bed, don't move. So definitely they may suggest that massage and everything is CI'd during that time. Because you're spending so much money and putting so much effort into trying to implant. Oh, there goes my picture. Can you still hear me?
I can hear you. Can you hear me?
Okay. Yeah, I just noticed my picture went away.
Okay, I can still see you moving live. So
okay.
I don't know. Yeah.
Okay.
Not to worry. Okay. Yeah, you're good. And your voice didn't stop.
Okay.
And I was going to say, not only, sorry, Nicole, to interrupt, not only do we not see research that would support no treatment in the first trimester, what we see in the literature is actually the opposite.
Yes.
From our American educator counterparts and colleagues, and in our Canadian literature.
Yeah.
What you're actually seeing is modifications to be done and expectations of presentations in the first trimester, which would assume that you should be doing massage or can receive massage in the first trimester of pregnancy.
Yeah.
So it really comes down to, I think, sometimes therapists just really wanting to err on the side of caution, so much so that then the effectiveness starts to drop down. And where we want to see our profession move is that the safety and the effectiveness are actually hand in hand. We're not just abandoning treatment protocols out of fear. Oh, I see a comment there. Somebody type in there and let me know if you can hear me.
Yeah.
And if you can see Nicole or if you only see me. There we go.
No, we're here.
Okay.
So when I started school, we were cautioned against using deep pressure on the low back as it may cause a miscarriage. That belief isn't really substantiated anymore, but I know it's still being taught by some instructors. And you're right, it's still, I don't know if it's necessarily being taught like in front of a class, or if it's through conversation that this is being told, or like the rumor is being spread through conversation. I'd be very surprised if this was actually being taught and presented to the whole class, or when someone pulls the teacher aside and says, hey, I heard about this, or you know what I mean? Like, I'd be surprised if it's in a manual that says that.
Right. Probably not in a manual, but probably articulated.
Yeah.
Because if we actually think about it, what causes a miscarriage? That's one of those, that's still something that doesn't have a clear direction of how that even happens. There's nowhere in literature that says this causes a miscarriage. It's always been stated that actually it's not always clear. Sometimes it's through, the splicing of the cells, something goes wrong.
Hormonal.
It's not implanted, hormonal. Yeah. It's very even rare. Sometimes people have major accidents when they're pregnant and they don't miscarry. So how would a massage done by a professional, even done by an amateur, create a miscarriage? So I would hope that this isn't still being taught, because
Yeah.
it's, what is it substantiated by? It's actually never been fact. It's
As,
never been fact.
as much as the massage therapy profession has moved forward in gaining, respect and a great reputation in the health community, when we are telling other therapists stuff like this, it almost kind of brings us back to, 50 years ago when massage therapists maybe were just for relaxation and we couldn't really provide any therapeutic benefit according to what people thought. And so when we're telling people this, like, it may cause a miscarriage if you do deep pressure in the low back, or massaging the lower back, or massaging pregnant in the first trimester at all, I feel like it really just downgrades what we do as therapists, and how much we can actually really help somebody in the first trimester, right? Like, we can help them so much. And there's so many patients that are not getting treated that actually want treatment during that time. And something we bring up all the time, you and I, is that how many people actually know they're pregnant the first 5 weeks?
First trimester, right.
Or even first trimester, right? So maybe they're finding out, like, once the first trimester is on, like, closer to the end of the first trimester, which we all know the risks are usually the first, like, 8 weeks. Some people don't even know.
Right.
So I don't know. I think that's a funny one. I don't think that we should be teaching that anymore in schools. We shouldn't be telling each other this rumor. I think it's unless we're seeing something that is put out by the college and there's, like, substantiated,
research
backing it up, then why are we even talking about it anymore?
Yeah,
why is it contraindicated?
I completely 100% agree.
Yeah, because it's just those little things, those little seeds that are planted that, like you said, start to create this fear that's not, like, actual clinical fear that, you may actually harm a patient because of, blood pressure or whatever else, is presenting in that treatment, right?
Right, exactly.
So, yeah, that's definitely one that I don't think we're going to, be able to get rid of anytime soon. But the more we talk about it, I think it helps, right?
Right. And I think you said not only does, providing massage during these stages show what we can do, it also gives us an opportunity to demonstrate our clinical reasoning.
Yeah.
We're not machines that touch for a living.
Yeah.
We touch with intention and purpose, and that purpose is created by treatment planning and discussion and reviewing a health history. And all of that feeds into our clinical reasoning.
Yeah.
And when we have statements that are like that, don't do massage in the low back, it can cause a miscarriage.
Yeah.
Then it takes out all the clinical reasoning. Clearly, if this patient was very high risk, if this patient had fear of having their low back massage because they truly believe that there could be a risk, these might be reasons why you might not work on the low back, but not because, in fact, it could cause a miscarriage.
Yeah.
So it's about being clear about why we're saying no to things, why we're saying yes to things, and being educated and confident to be able to share those whys with our clients, because they should be educated by us.
Yeah.
We are actually experts in the area.
Yeah. And I like what you said there about us educating our patients, because we also, like, have to have the empowerment of our patients too. And if they really have a fear or they're really not comfortable with something, it's not our place to, force them to do something they're not comfortable doing. But I do think that it's our responsibility to educate them.
For sure.
Yeah. So I think that's great.
For sure.
So speaking of all of this, dispelling the myths and our training and everything, we actually have a course coming up this coming weekend. I saw someone just posted on our Facebook group, the Pregnancy Massage Therapists Canada. If you're not on it, please join us. And I saw that someone asked when our next infant massage training is. So next weekend, not this Thanksgiving weekend here in Canada, but next weekend, the 13th and 14th, we are actually going to be in Stony Creek at the Ontario College of Health and Technology. And we have a one-day pregnancy course that is taking place on Saturday. And a one-day infant massage course is taking place on the Sunday. And you will be able to access your manuals online. The pregnancy course, you will have to answer some questions just to make sure you've gone through your manual and that you understand the content that's being given. And then both days, it's all hands-on practice. We have live patients coming in to do a clinic both days. So if you are interested, we will post the link below in this chat, and then that way you can use the link to sign up.
Yep. Really looking forward to seeing the therapist this next weekend. It's always great to teach this stuff, especially with therapists that are interested in this.
Yeah.
Maybe they have a small practice building. Maybe they have a completely different practice and they're ready for something different.
Yeah.
Working in this niche of pregnancy, infant, postpartum, there's never a shortage of interesting cases.
Yeah.
There's never a shortage of clientele, clearly.
Yeah.
And of course, this is where I have the most fun, being able to work with an entire family unit. It's pretty incredible.
Yeah, it's so great. I've had so many patients come in and see me throughout all of their pregnancies, some having 2 kids, 3 kids. And, every time they've had their baby and I say, come in, bring your baby with you. I don't mind, as long as you can get in for treatment. How many times is baby being rocked by maybe my foot as I'm massaging, or, crawling on the floor once we've made the room safe, or, on mummy or on the table. I think it's really great to be able to incorporate the family into the treatment, even if they can't maybe receive massage themselves that day. They're just a part of the session.
That's right.
Yeah.
I totally love that. Then there doesn't need to be any disconnection. People don't have to choose. Feed my baby, who may only want breast milk directly from the breast, or get a treatment. I love that there's the opportunity to do both.
Yeah.
Bring your baby, feed your baby if your baby needs to be fed, and get your treatment.
Yeah. Yeah.
Feed your baby and get your treatment at the same time. Whatever works.
Yeah.
I really love this world of massage.
It's funny.
That's what they need.
The other day I came out of treatment and I looked at the receptionist and I said, I'm really sorry about my singing, because the baby woke up and I had to sing The Wheels on the Bus, and I'm not a singer at all. But I was singing because so the mom could just relax. You know what I mean? Otherwise she would have to be alert and start singing. Right? So I was massaging, looking at the baby, singing Wheels on a Bus, giving the baby attention. And it's just so great because the mom could just lay there and be quiet. Even though she has me singing in her ear, and she's probably thinking geez, girl, you're not that good.
She was happy to get a break,
Yeah, I know.
Yep.
But
it's like us reaching over, massaging, reaching over, putting a soother back in.
Totally. Toy drops,
That glider thing that I was telling you about, even though I have some questions now about the whole car seat thing, but we'll get to that another day. We'll get to that post another day as we wind down. But come and join us in Stony Creek. This is our last course of the year. So our last pregnancy, our last infant massage. We just got our last postpartum for 2018. So if you want to change your practice, build your practice, improve your practice, or expand it, come join us.
Yeah, whether you're a new therapist, you've been practicing for 10 years, 15, 20, 30, it does not matter. You will not be disappointed in our training. And we always have such a great group of therapists that join us. Last time we were teaching our postpartum course, we laughed the whole day. And it was such a heartfelt day because people really shared personal experiences, which was really just kind of adds to it, which I thought was just so beautiful. And I love working with babies, and we get to have little babies this next weekend. And that's amazing too in our infant massage course. So, you don't have to sign up for both. If you want to just join us for one, please do so. We're going to put both of the links underneath here. And I think that's all I really have to say today. So please join us next Thursday at 8:30 on the Facebook page. And I hope you Canadian people all have an amazing Thanksgiving weekend, nice long weekend. And get lots of turkey in your belly if you're a meat eater, and if you're not, lots of pumpkin pie.
Exactly. Have a great Thanksgiving, everyone. And thanks for joining us.
Thanks for joining. Bye.
Bye.